So, an ostomy is a connection of your intestine out to the skin. There can be two types of ostomies. One connects the small intestine to the skin, we call an ileostomy, or one that connects the colon, something that we call a colostomy. Your surgeon will let you know what they recommend as the best type of ostomy for your child to help take the best care of them.
In both types of ostomy, food goes from the stomach into the small intestine. The process of breaking down and digesting food begins in the stomach and continues in the small intestine, which has three separate parts. Food goes from the duodenum to the jejunum to the last part of the small intestine, which is called the ileum. Almost all digestion happens in the small intestine. At the end of the small intestine, any food that has not been digested and absorbed goes into the colon. At this point, the contents of the intestine, which are called stool or poop, are very liquid. The stool next moves into the large intestine or colon, where water is absorbed, making the stool firm and solid. In a normal intestine, formed stool is stored at the end of the colon in a section called the rectum until it passes out of the anus during a bowel movement. In some children, there's a blockage, disease, or other process that doesn't allow the stool to go all the way through the intestine. In that situation, your surgeon will make an opening allowing the stool to come out, which is what we call an ostomy. If the opening for the ostomy is made in the large intestine, it's called a colostomy. If the opening is made in the small intestine, it's almost always placed at the very end of the small intestine in the ileum and is called an ileostomy. The higher up the intestine the ostomy is made, the more liquid the stool that comes out will be, and the less water the body will be able to reabsorb. Sometimes your surgeon will bring up both ends of the intestine where it's been divided so that there will be two different stomas, but only one will have the stool coming out. The other is called the mucus fistula and lets mucus and gas escape from the intestine. Your surgeon will explain the exact location of your child's ostomy to you. Remember, if you have any questions, please ask.
How is an ostomy closed?
Most, but not all, ostomies are reversible. Your surgeon will talk to you about whether your child's ostomy can be reversed. An ostomy is reversed by reconnecting the two halves of the intestine back together inside the belly, allowing the stool to pass all the way through the intestine again. The place where the stoma was closed, there will be a small scar.
What about after surgery?
Well, anytime a child has abdominal surgery, they'll be sore for a few days, but we'll make sure that they're comfortable with pain medicines. After they go home, we may restrict the activities for a while to allow things to perfectly heal. But remember, the stoma doesn't have nerve, so itself won't hurt. And stomas don't get infected. Your child will be back to their normal activity before you know it.
Won't the stoma get infected by stool?
After it's had time to heal, the stoma is not fragile and it won't get infected. Except for some restrictions on food, which we'll tell you more about later, children will go back to doing all the things that they were before they had the ostomy.